Hi, this is Dr. Dave Peterson. Many have questions on how to control problematic hot flashes. Should they be on hormone replacement or supplemental support? Why they don't feel any different when hormone supplements or hormone replacements are used? Why can't they get a good night's sleep without waking up soaked or having to change their clothes? Well, how are the hormone replacement prescriptions or supplements working for you? You know, if you do what you've always done, you'll get what you've always gotten. Maybe it's time to take a new look at hot flashes. Hopefully, I will be able to answer those questions for you. Let's get started. Hormone replacement has become synonymous with hot flashes. However, with the evolution of scientific and medical developments, there's an increased knowledge about hot flashes, their causes, and hormone replacement therapy. We can now ask, how do hot flashes occur? What role do hormones play? Is there a direct association, or is it just close enough? You know, close only counts in horseshoes, hand grenades, and healthcare. Let's get started with this bit of information. The symptoms you experience during a hot flash are carried out by the vasomotor component of the NEI supersystem. We'll talk more about that later. Of all the vasomotor symptoms involving menopause, hot flashes are by far the most common. But as you will learn later, you do not have to be going through menopause to have a vasomotor hot flash. Every woman's symptoms are different. These symptoms can be hot flashes, dry skin, itching, crawling sensation on the skin, sleep issues, a sudden feeling of warmth spreading through your entire upper body and face, a flushed appearance with red blotchy skin, rapid heartbeat or palpitations, perspiration, mostly on your upper body, feeling chilled as the hot flashes subside. These symptoms have always been attributed to fluctuations in hormones and changes in estrogen levels. However, in reality, these are a result of an imbalance in the neurotransmitters, cytokines, and chemokines of the NEI supersystem with just a slight influence from hormones. There are several different estrogens with different effects in the body. However, in healthcare, estrogens are lumped together as one hormone. Looked at functionally, estrogens play different roles. Estrone is the menopause hormone. Estradiol is the main hormone during a woman's reproductive years. Estriol supports pregnancy. And looking at this, I don't see anything here that would contribute to hot flashes. All hormones are made from cholesterol. The enzymes, seen here in blue, convert the preceding hormone into the next downstream hormone depending on your body's needs. Using progesterone cream can cause artificial increases in all hormone levels. Progesterone cream will eventually convert into one of the estrogens, testosterones, or inflammatory etiocholinone. A woman nearing menopause does not want her uterine lining thickening from excess estriol, as it would during pregnancy. The result of this is often seen as fibroids. In the body, we view the arteries, veins, and lymphatics the same as the water pipes in your house. Always the same size, always the same amount of fluid, and the pipes are only a problem when one springs a leak or gets clogged. Well, what does this have to do with hot flashes and hormones? The endocrine glands release hormones into the bloodstream, where the endocrine hormones travel long distances throughout the body through the bloodstream until they reach a receptor site on a faraway organ. There is no tracking number on hormones like shipping a package with UPS or FedEx. It's more like putting rubber duckies in a stream, letting them float downstream to be picked up. Sometimes they get there, sometimes they don't. Did you know that a 19% increase with vasodilation of a vessel will double the blood flow, while a 16% decrease during vasoconstriction will cut the blood flow in half? Dilated blood vessels will cause the hormones to be diluted with the increased fluids and less likely to reach a receptor site, while constriction of the blood vessels, on the other hand, will reduce the flow, causing a decreased amount of hormones to pass by the receptor sites in the intended tissue. This also results in altered feedback in the areas producing the hormones. Your hot flashes are in part the result of a changing in the size of the blood vessel diameter between different areas of your body, leaving you with the symptoms of hot flashes, night sweats, chills, or insomnia. You may have heard this old adage about men, the one where they have two brains but only enough blood to run one. Well, it's true. But the second brain is in the abdomen, not where you're thinking. The blood supply throughout the body is controlled by the autonomic system. This automatic system controls everything the body needs to do that you don't need to take the time to think about. This system also directs your body's resources to where you need it most. The blood, like the ocean water levels, remains the same, but the flow of the tides will change throughout the course of the day. The same way, the blood supply will move outward and then inward throughout the day depending on your activities, just like the ocean tides. The stress of daily life, exercise, or activities will send resources out to your muscles, heart, lungs, and brain, as well as the outer parts of your body like the skin, while eating, sleeping, and libido will send resources inward to the abdominal compartment, controlling digestion, fat cells, and sex. The body is the ultimate energy conservator. Both systems should not be turned on at the same time. The autonomic system will dim one system down while the other is being used. So it can be said the same is true for women. There's not enough resource to run both brains at the same time, especially if you're having hot flashes. When health deteriorates, one of the automatic systems will predominate over the other. A person that is sympathetic dominant will find their blood supply pooling in the outer parts of their body. Muscles need carbon dioxide, lactic acid, and other byproducts of movement cleared and fresh resources brought in. The same could be said for the brain. The automatic nervous system turns on the heart and lungs in the thoracic compartment when there is any distress, and this may cause palpitations and racing heart. The sympathetic system has only the resources for a limited amount of time, and this results in the parasympathetic system becoming dominant because that is where the body's resources are first processed. Chronic health issues will also deplete the NEI supersystem of neurotransmitters, cytokines, chemokines, and hormones necessary to maintain good health. When a person becomes parasympathetic dominant, the blood supply will pool in the abdominal compartment, becoming stagnant around the weakest organ. The automatic nervous system turns the organs on in the abdominal compartment, and fat cells are stuck in storage mode, making it difficult to lose weight. And this is often the case for all those that get accused of being closet Oreo eaters while exercising 7 days a week. The resources for sex and libido are also turned on, but are out of sync with the hormones. I've found that most people with health issues are parasympathetic dominant. In all healthcare, the prevailing notion is parts are parts. Everything is separate from the whole. Endocrine hormones are treated as a system separate from all other parts of the body, when in reality, no part of the body can be understood separate from the whole. The endocrine system and hormones are a part of the larger NEI supersystem. When viewed functionally, the various parts of the NEI supersystem are very intricately connected. Some women have night sweats, which are hot flashes that occur while sleeping and are disruptive to sleep, and not to mention the need to get up and change clothes or sheets. When you wake, your system has shifted into sympathetic mode, with a rapid flush of blood to the surface of your skin and the activation of the sweat glands. The inhibitory neurotransmitters are necessary to control this. And this occurs when the automatic vasomotor control of the NEI supersystem is unable to hold you in the normal parasympathetic pattern needed for sleep. This is the result of a depletion of the inhibitory neurotransmitters. We have nutritional support for the depleted neurotransmitters that work very well. Heart palpitations and racing heart occur when both the sympathetic and parasympathetic systems are turned on at the same time. This also involves the uncontrolled release of the immune system cytokines in response to inflammation, and the depleted neurotransmitters are unable to restore control. The heart is trying to pump blood, but the blood vessels throughout the body are either dilated or constricted, making it difficult to pump blood and maintain proper blood pressure. You may have experienced a situation similar to this while in the shower. Someone flushes the toilet, the dishwasher and the washing machine are running, and you're either scalded or frozen with cold water. The horseshoes, hand grenades, and healthcare approach to healthcare provides us with multiple names for the same condition. Notice the similarity of the symptoms between hot flashes and cytokine release syndrome. Both are names for the unbalanced NEI supersystem. Yes, hot flashes are a result of an unbalanced neuroendoimmune supersystem. Hormones only play a small role, while neurotransmitters play a larger role. How do I know this? Well, I don't get to come up with a different version of the way the body works. I just look at it for how it does. And by knowing how things work, I am able to see where things are broken. Take, for instance, estrogen. I would bet that for many of you, this was the first time you learned that there are 3 different estrogens that play 3 different roles in a woman's body. I also have practical experience. For years, I tried following the standard dogma of using hormone support for hot flashes with little to no success. The only saving grace was there was no expectation of relief. It's mainly just, well, let's try the same supplemental ingredients that didn't work the last time. You know, if you do what you've always done, you'll get what you've always gotten. This is a chart I made so I could better understand the influence that the NEI supersystem has on hot flash symptoms. As you can see at the bottom, hormones also influence the immune system and the size and permeability of the blood vessels. Many think low DHEA on a lab test is a deficiency and resort to using DHEA supplements. I no longer think it's a deficiency. I think it is flowing downstream into etiocholinone. This little-known hormone is involved in hot flashes and is overlooked by many in healthcare. Etiocholinone doesn't fit the endocrinologist's focus on sex or thyroid hormones because it's an inflammatory hormone. It's also one that's not easy to look up because it has 69 different names. So just how is acetylcholinone involved in hot flashes? Well, to start with, acetylcholinone is an integral part of the immune system responsible for the initiation or stimulation of short fevers. One might describe these as hot flashes. Acetylcholinone is normally cleared rapidly by the liver. However, bacteria cause a shift in the gastrointestinal environment, altering the liver's ability to clear toxins from the body. Bacteria cause bile to convert to toxic secondary bile acid, which prevents acetylcholinone from being inactivated and removed. The elevated levels of acetylcholinone continue to stimulate hot flashes as well as more inflammation throughout the body, often resulting in the onset of autoimmune diseases. As you can see, acetylcholinone can be produced in either the stress or sex hormone pathways. The healthcare community fails to connect either pathway in which this inflammation hormone is produced, causing hot flash symptoms. Chills are a feeling of coldness occurring during the release of cytokines and prostaglandins as part of the inflammatory process, which increases the set point for the body temperature in the NAI supersystem. The increased set point causes the body temperature to rise, but also makes a person feel cold or chilled until the new set point is reached. Shivering also occurs along with chills because the body produces heat during muscle contractions in an attempt to increase body temperature to the new set point. Hot flashes are no longer a mystery since I've taken the time to look at what's really causing them. I recommend lab testing to determine the specific support you need rather than some one-size-fits-all, here, try this approach. If you would like more information or help with your hot flashes, I welcome you to visit my website, www.stl.com, and please check out my blogs as well. To make an appointment, please call 530-615-4083. If you do not live close by, we can help you remotely as well. I'm looking forward to hearing from you. In good health, this is Dr. Dave, wishing you a good day. The information and therapies outlined in this video are not intended as a substitute for personalized medical advice. The content of this video is intended for informational purposes only. The medical information in this video is intended as general information and should not be used in any way to diagnose, treat, or cure or prevent any disease. Procedures and products described should not be considered as adjunctive to any other accepted conventional procedures deemed necessary by the attending licensed doctor.